Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
This is Nina Liu, and I'm here with Shukla from the University of Washington.
We're here on the About the Face podcast to discuss our retrospective study, the timing of treatment and initiation effect on facial synkinesis outcomes. We wanted to study this topic because in our facial nerve center, we often see patients presenting several years after their initial episode of facial paralysis, typically Bell's palsy, with bothersome synkinesis symptoms who had not received any form of treatment. In particular, the facial therapy literature there is concerned regarding chronic shortening and tightening of facial muscles, for example. And we were wondering if patients with chronically untreated synkinesis would be less responsive to treatments, such as neuromuscular retraining and chemodenervation.
To study the effect of timing of treatments on outcomes, we designed a retrospective review of patients with facial synkinesis presenting to our facial nerve centers. We looked at synkinesis outcomes using the pre-treatment and post-treatment Sunnybrook scores. We had 78 adult patients in our study, of which 73% were female. The median age was 50 years, with a range of 18 to 78 years. Median patient follow-up time was 16 months, with a large range of 1 to 56 months. We divided patients into 3 groups based on time between onset of their paralysis and initiation of treatment. The 3 groups were less than 12 months, 12 to 36 months, and greater than 36 months. Our main finding was that the use of facial neuromuscular retraining and chemodenervation improved Sunnybrook scores for all our patients. That is, we found that the time between paralysis onset and treatment initiation was not associated with a difference in post-treatment Sunnybrook scores, which was in line with our clinical observations.
Even within the medical community, the understanding of the various treatment options for facial synkinesis is lacking. Thus, there is often a delay in patients receiving any form of treatment for a facial synkinesis. And patients often come feeling guilty for not, quote unquote, doing something sooner. At least in this preliminary study, we didn't find a difference in terms of the timing of their initiation of these particular interventions. This indicates that it's never too late for patients to achieve their best possible outcome for synkinesis. Hopefully, this can provide patients with some comfort if they have postponement of care for facial spasm and synkinesis, and also spur future research studies in this regard.
And future studies could look into whether the initiation of therapy first or chemodenervation first affects ultimate outcomes. Another avenue for future study is if therapy or chemodenervation in patients within the first 12 months of their facial palsy can reduce or ameliorate the ultimate degree of synkinesis that develops. Thank you.
Thanks, everyone, for listening to the podcast, and hope you all find the paper interesting. Feel free to reach out to us with any questions.
We'd like to thank the authors for their commentary, and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.